Hi everyone, this is Dr. Baksh, and today's topic is febrile seizures. So let's go over the definition. It is defined as a seizure or a convulsion which occurs in febrile children between the ages of 6 months and 5 years of age, and who do not have an intracranial infection, like there is no meningitis or encephalitis, no metabolic disturbance like hyponatremia, and also there's no past history of any afebrile seizure. It is the most common type of convulsions in children less than 5 years of age, and it carries a very good prognosis because the complications are less and there's no brain damage. So this is a criteria for febrile seizures. Uh, a convulsion which is associated with fever greater than 38 degrees centigrade, a child younger than 5 years of age, there's no sinus infection, inflammation, there's no acute metabolic abnormality, and no history of previous afebrile seizures, like we mentioned before. Okay, so now let's talk about the pathophysiology. It is not exactly known about why high fever causes seizures or fits in a child. However, there are some considerations. It's been said that it may be due to some release of cytokines during the fever, like interleukin 1b, which enhances the excitatory receptors in the brain. It may also be due to some temperature-regulated ion channels in the brain, which open up during high fever. And it may be due to hypothermia-induced hyperventilation and alkalosis, which ultimately does causes excitation of the neurons. So the clinical presentation, or if you can say types, it is divided into two types, simple and complex. Simple is also called typical febrile seizure, and complex is also called atypical. Uh, this classification is basically based on the clinical presentation. Almost all kinds of febrile seizures, they present with generalized tonic-clonic seizures. So first we will have a tonic phase of hypertonia, followed by a clonic phase of muscle contraction, which is present in both, which is common in both. Now the simple seizures, these are the most common one. At least more than 90% of the cases are the simple ones. While complex, they are less common. In simple, the episode lasts from anywhere from 5 minutes to 15 minutes. But if the episode lasts more than 15 minutes, it's a complex seizure. And the attack is, there will be one attack in less than 24 hours. But in complex seizure, there will be more than one attack. Now, the causes of fever. It could be many causes, but mostly are the viral infections. It could be due to some upper respiratory tract infections, otitis media in kids, UTIs, and even fever following immunizations, particularly the DPT vaccine and the MMR vaccine. So the diagnosis. Now the diagnosis is completely clinical, but we can do some routine labs as well uh, to check the CBC, serum electrolytes, blood sugar, calcium, and the blood urea nitrogen. Lumbar puncture is indicated when we need to rule out meningitis. Neuroimaging is usually not done. EEG is done if the seizure is complicated, and it should be done 1 week after the illness. It is done because if we do it immediately, it might show some transient changes, which might be due to the high fever or due to the conversion itself. So, the American Academy of Pediatrics, AAP, they have some recommendations for performing the lumbar puncture in febrile seizures. These are when meningeal signs and symptoms are present, if the infant is less than 1 year and the immunization status is not very clear, especially regarding the hip or streptococcus pneumonia, or if the patient is on antibiotics because it can mask the signs and symptoms of meningitis. So it's any child who comes with the high fever and fits, it's very important that we need to be very clear that it is not meningitis. Now let's talk about recurrence. Recurrence occurs in 30 to 50% of the cases. Well, 50% of the cases in children who are less than 1 year of age, and especially if there's a family history or if it's a complex seizure, there are more chances of having recurrence. Now, talking about treatment, the treatment is twofold. So basically, what we need to do is we need to control the seizure and to lower the temperature. So for the lowering the temperature, we can use antibiotics like ibuprofen and paracetamol. The dose for ibuprofen in children 6 months to 12 years of age, it's 5 to 10 mg per kg orally every 6 to 8 hours. And paracetamol, it's 10 to 15 mg per kg orally or rectally every 4 to 6 hours when required. So moving on to anticonvulsants. So our general principle is if there's a seizure which is lasting for more than 5 minutes, only in those cases we consider giving the anticonvulsants. So we give an initial dose of rectal diazepam, and if the seizure does not stop in 10 minutes, we give another dose. So after 2 doses of rectal diazepam fail, we give 1 dose of IV fosphenytoin. And after that, if the seizure is still there, we can go for IV diazepam or even lorazepam. And if all these methods fail, we need to consult a specialist. Now, anticonvulsants. So for the dose of anticonvulsants, we use either diazepam or midazolam. So diazepam in infants and children, the dose is 0.1 to 0.3 mg per kg IV as a single dose, and we can repeat after 5 to 10 minutes. In children 2 to 5 years of age, the dose is 0.5 mg per kg rectally as a single dose, and may be repeated in 4 to 12 hours if required. Now we need to understand that in children less than 2 years of age, we do not give it rectally. So instead of if a child is seizing and we are having difficulty getting the IV line, we can give midazolam as a buccal dose. So for children 1 to 2 months, it's 300 micrograms per kg buccal dose, and can be repeated after 10 minutes if required. So for children 3 to 11 months of age, 2.5 mg buccally. Children 1 to 4 years of age, the dose is 5 mg, and for 5 to 9 years of age, the dose is 7.5 mg. So these are just some general considerations to tell the parents when to call triple line or ambulance or to go to the ER. If the seizure is happening for the first time, or if the seizure lasts more than 5 minutes and it's showing no signs of stopping. And if you suspect the seizure is caused by some other serious illness like meningitis, and also if the child is having breathing difficulty, especially if he develops cyanosis. So that's it for today. Do give a thumbs up if you liked the video, and do subscribe for more videos. Bye bye.